3, 2.
Good evening, everyone. Welcome to the Delaware County Needs-Based Plan and Budget meeting for July 29th, 2005. I'd like to welcome everyone who is present here, and a special welcome to Dr. Taylor, our Chair of Delaware County. Sitting here before you are Dorothy Stewart, our Director of Quality Assurance, Policy and Planning, Gretchen Sidler, Deputy Administrator of Children and Youth Services. I am Vanessa Pierre, the Agency Administrator. I have Thomas Simonson to my left. He is the CYS Fiscal Officer 2. Nelson Walker, the Interim Director for Juvenile Justice Services. And Danielle DiMatteo, the Chief of Juvenile Probation.
Good evening. So the purpose of our meeting tonight is to gain public input on our proposed needs-based plan and budget for Children and Youth Services, the Office of Juvenile Probation, and Juvenile Detention Services for fiscal year 26-27. Tonight we'll review the budget and implementation plan for fiscal year 25-26.
You want us to start?
Yep.
Okay.
So I'll turn it over to Dorothy.
Hello, everyone. So when we build our needs-based plan and budget, we try to include our stakeholders in that endeavor. So we work with families and get input from our families that we work with, from the juvenile court and children's roundtable, from our providers, in-home placement and family engagement, from our staff. We do meetings with our staff and our administrative team. So Thomas is going to present our budget, and then Gretchen and I will go into the CYS plan for this year.
Thank you, Dorothy. The budget for fiscal year 25-26, Delaware County has received the tentative child welfare budget allocations for 25-26 as recommended by the Pennsylvania Department of Human Services Office of Children, Youth, and Families. The tentative budget is in the amount of $53,651,803. In addition, child welfare funds tentatively approved for 25-26 fiscal year budget, Delaware County has been approved for an additional $7,769,477 for Pennsylvania Child Welfare Special Grants, including Independent Living Grant, Housing, Truancy, Evidence-Based Programs, and Information Technology. The needs-based budget request for fiscal year 26-27 is approximated to be $61,482,996. That is a requested increase of $7,831,193, or 13% more from the fiscal year 25-26 implementation year budget. A significant portion of the increase can be attributed to increases in placement per diems. We didn't update this, did we? In placement per diems, salary and benefit costs, new and revised regulatory requirements, including the Family First Prevention Services Act. Excuse me. The cost of Delaware County Child Welfare Services is funded through a combination of state at 66%, federal 14%, county 19%, and other at 1%. In addition to the funds requested in the fiscal year 24-25 needs-based child welfare budget, Delaware County is planning to request $8,935,000 for Pennsylvania Child Welfare Special Grants. The request responds to the need for additional housing assistance for families and the expansion of legally required independent living services for older youth. Special grants receive higher levels of federal and state reimbursement. Part of that, I just want to expand a tiny bit. When I mentioned that there's a 13% increase over what our implementation year budget is, in our request for the needs-based budget. That is because we were denied last year some of the funding that was requested. In reality, the increase is at 2% over what the ask was from the prior needs-based budget. And we'll move on to Children and Youth Services. I'll pass the baton.
So we look a lot at our data and statistics about how many families we serve. So this year, we completed over 3,100 investigations of child abuse and neglect, and we received almost 9,000 reports from Childline. We provided ongoing services to over 750 children in Delaware County to ensure safety. That would include both children in placement and the majority of the children who were served at home in their communities. So when we look at our strengths this year, the number of dependent children in out-of-home placement decreased by 10% from the prior year, and it has decreased 19.4% over the past 5 years. We have a lower placement rate of children in out-of-home care per 1,000 than the other Class 2A counties, the region, or the state, and this has been consistent over several years. So if you see the chart on the screen and the trend line at the bottom, that's the number of children that go into out-of-home care per 1,000 in Delaware County. The lines above that represent the Class 2A counties. We are a Class 2A county. The Southeast region and the state. So we have been consistently lower in our placement rates. Children in out-of-home care are achieving timely permanence faster. We had 39 children in out-of-home care adopted this year, and 1/3 of those children were in kinship foster homes, so they were adopted by their own families. When children can't return home safely to their parents, we've seen an increase in permanent legal guardianship, subsidized guardianship with family members and kin. One of the things that was difficult for the agency this year has been our high vacancy rate, which we experienced last year, and we went into this fiscal year with a provisional license. But we're very happy to say that we've returned to full licensure, and we've made some gains in filling our caseworker positions. We also had a resource fair this year. For our staff, for the staff with the Office of Juvenile Probation. We invited other county stakeholders. We had approximately 25 to 30 providers that do not contract with the county that were there to share what they have to offer to families in the community. So it gave our staff a huge amount of new information and new support services. And I want to thank Chelsea Rogers for organizing that for us. She is in our Quality Assurance Department. The other thing I wanted to let you know is we have continued to expand our use of evidence-based programming to support children and families. So now we've always had, for a long time, we've had family group decision-making and crisis rapid response meetings. We also have family finding, and we'll be expanding that. We subsidize multi-systemic therapy for children until their MA comes through. We have Nurturing Parents, Triple P, an evidence-based parenting program. We just started Safe Families for Children. We have Y-Try, which is an evidence-based program for truancy. And in 26-27, we hope to bring home builders on board. And I will turn this over to Gretchen.
Thank you and good afternoon. Children and Youth Services has seen an increase in the number of children with very complex medical, mental health, and behavioral health needs requiring agency services. The Office of Children, Youth, and Families have identified this as a concern for many counties, and one of the priorities the child welfare system has at this point for our system. Often these children are not able to remain in their home, and finding placement settings and providers able to meet their needs has become increasingly difficult. While overall placement is down, which is great, the agency has not experienced a significant decrease in congregate care. Additional challenges, oops, there we go. Additional challenges include the closing of the Crozier healthcare system, which has exacerbated this crisis for many youth. There are fewer options for medical and mental health services in our community. Children and Youth Services has also partnered with the Office of Juvenile Probation, the Office of Mental Health, and other child serving systems to review high-risk youth on a consistent basis and to work together to wrap available community services around these children, both for children remaining in their home, but also for children who are in out-of-home care, trying to utilize all the community resources to keep their placement stable. Additionally, the rise in truancy referrals in our county has remained consistent since the pandemic. We have 3 diversionary truancy programs which are funded by our agency, special grants, and the agency. Despite these, we still investigated 400 investigations on truancy this year. In those referrals, child welfare was also identified, child welfare issues were identified as a concern. The State Commission on Truancy issued a report in 2024 recommending school funding for dedicated truancy staff and the use of student assistant programs as a first response to truancy. CYS will continue to track trends and outcomes for funded truancy diversion programs. We remain very concerned about the number of children in the elementary schools who are chronically truant. It's one of the areas that we are really trying to focus on we think focusing on that will help prevent later truancy if we identify it now. Other challenges for Children and Youth Services include the agency has been able to fill more caseworker vacancies. However, vacancies in the intake department remain very high. At the end of the fiscal year, there were 19 caseworker vacancies in intake. Children and Youth Services will continue to focus on recruitment and retention efforts to staff and for support for them around vicarious traumatization. Kinship foster care, as you saw with our strengths, we had many adoptions that were kinship related, but our overall percentage of foster care children with kinship has decreased. Finding family and engaging their support to care for children when necessary and assist parents is our best practice, and we continue to strive to meet that. Moving on to our priorities for fiscal year 25-26 and fiscal year 26-27, the priority of Children and Youth Services is to continue to stabilize the workforce and focus on retention and recruitment of staff. Children and Youth Services is working with the Child Welfare Resource Center and the Office of Children, Youth, and Families on actionable steps to recruit and retain qualified staff. CYS staff are part of the state committee to address recruitment and retention challenges for all of the child welfare in Pennsylvania. Children and Youth Services upper management participated in a comprehensive leadership training that will be provided to all of our management staff. Staff have access to a licensed clinician who will meet with them privately to debrief about work situations and address trauma. And we are holding focus groups with both management and casework staff to address effectiveness of agency services and programs, as well as what they need to feel supported as they go into the community to work with our families. Additional priorities, Children and Youth Services is increasing the reach of focus for evidence-based programming. We have contracted with Safe Families for Children, which is an evidence-based program that utilizes well-trained and supported community volunteers to help families. If a parent needs someone to care for their child while they attend treatment program or enter into a hospital situation, they would be able to utilize these volunteer families for their children to be cared for by them and not have to enter foster care or get involved in the dependency system. Additionally, the agency will release a request for proposal for home builders to begin fiscal year 26-27. We've identified that we need more supports for our latency age children where issues around parent-child conflict, truancy, behavioral issues have surfaced, and we are feeling if we can put more intensive services there, out-of-home placements will decrease later on when they are more high school aged.
I just wanted to add, too, that our evidence-based programs, just like Home Builders and Safe Families, are funded at 95%. So we get funding for all evidence-based grants at 95%. So when we look at grants and we look at in-home programs, we really look hard at evidence-based programs that the state will give us increased funding for and that have efficacy and that we can ensure model fidelity. The other thing we just wanted to add was we remain focused on continuous quality improvement. We released a request for proposal for our independent living services, and those proposals are now under review. We're using existing positions. We have so many certified positions, so we're using existing vacancies to expand our family engagement department. Right now, we want to use the Kevin Campbell model for family finding, and we hope to expand that by the end of 26-27 to 4 caseworkers that will work with families to help identify supports for them, but also when can want to become foster parents, they're going to stay with them and guide them and walk them through that process. The intake department also wants to use some existing positions to develop a second shift, a 3 to 11 shift. This will hopefully take some of the stress off of that department who are on call 24 hours a day, 365 days a year. So in addition to just having our emergency services, we'd like to split the day into 2 shifts. And I think that's all for CYS right now. Turn it over to the Office of Juvenile Probation.
Hello, my name is Melanie Govan, and I am currently the Interim Deputy Director of Delaware County Juvenile Court and Probation Services. Our department's role in the needs-based budget planning is much simpler than that of CYS. Specifically, the needs-based funds only support juvenile court services directly provided to our youth and families. They don't support our department's general operations, salaries, or activities unrelated to the direct service delivery to our clients. So over the next few minutes, Dan Burke and I will provide some information on what our department does, what our goals are, and what challenges we face, as well as what we'll prioritize over the next fiscal year. So we do have, let's see, we do have 4 offices throughout the county. We have a media office, Chester, Sharon Hill, and Havertown. If you might be wondering, yes, that used to be our 69th Street and Upper Darby office. They've relocated to Westchester Pike and Havertown. We have these 4 locations because it allows our clients to visit us without significant travel, and it also allows the probation officers to be more intimately engaged with the schools, police, and other organizations in the surrounding community. So Juvenile Court and Probation Services operate under the authority of the President Judge of the 32nd Judicial District. We also operate under the authority of the Pennsylvania Juvenile Act and the PA Supreme Court Rules of Juvenile Court Procedure. So as you can imagine, a probation officer in juvenile court takes on many roles. Not only are we tasked with enforcing the orders of the court, but we supervise juvenile offenders. We assess risk and treatment needs of our youth. We make recommendations to the court regarding appropriate disposition plans. We make referrals for programming that match the needs of the clients. We develop supervision plans that help our youth succeed. We deliver interventions intended to build youth skills to reduce recidivism, and we ensure the overall safety and well-being of our youth and communities. When talking about juvenile justice in Pennsylvania, we're always talking about the concept of balanced and restorative justice. So more specifically, probation officers and the courts are constantly striving to ensure that every disposition plan equally balances 3 concepts. The first of those concepts is community protection. So if it's determined that a child represents a risk to their own community or themselves, we may have to utilize tools like curfews, GPS monitors, or even residential placement. The second concept is victim restoration, also referred to as accountability. So we do have a victim service program within our department that serves all victims of juvenile delinquency. That program ensures that all of the victims' rights are protected and that their feedback and concerns are relayed to the court appropriately at and that to be quite honest, that the victim doesn't always get the outcome that they desire, but our staff are there to support them, refer them to services, and just advocate for them throughout the process. So juveniles may be ordered to pay restitution, which also addresses the second piece of balanced and restorative justice. They may have to stay away from a victim or complete community service to restore the victim community after they acknowledge the harm that they might have caused through their offense. Youth redemption is the third piece of the puzzle and is also referred to as competency development, and that's probably the part of our function that relates most to the needs-based budget planning, and also is, to me, the most challenging but most rewarding part of juvenile probation work. We aim to equip all of our juveniles with the skills necessary to move on from juvenile court involvement and be productive, successful members of society. So for some of the kids, this includes simple concepts and skills, like helping them get a job, time management skills, but for some clients, it includes more complex issues, like mental health management, addiction treatment, or overcoming trauma. Often juveniles make a bad decision. They learn from it and they move on. However, some juveniles will continue to break the law if there's no significant change in their thinking, attitudes, or behavior. So these are the juveniles that need us the most, and as you'll see, we focus most of our attention on. Here you'll see a 2023 report, a pretty picture from JCJC's annual report. They publish a report detailing statistics regarding statewide data. They had it published in time for this meeting last year, but unfortunately that didn't happen this year. But I've left the slide in because it actually is very similar to the way our data looks this year. And I imagine it's similar to the other data across the state. So I figured rather than take it out, I'll leave it, but let you know that we did have 1,082 allegations filed in 2023. That means 1,082 youth were referred to our department for violations of the law. We did see a slight decrease to 946 allegations filed in 2024. As you can see, kind of, not really, it's really small, but this shows you that the counties, it gives you the percentage of delinquency placements, as a percentage of dispositions. So out of over 2,500 dispositions, 30 of ours were placement dispositions in 2024. So you're looking at a map of 2023, and if you look down in the corner at Delaware County, you would see that about 1.4% of all our dispositions were youth being committed to placement facilities. That's actually decreased for 2024. I don't have the pretty map from the state to prove it, but in reviewing our stats, our placements have gone down to 1.2% of all of our dispositions. So as you can see, we're committed to using the least restrictive means possible in working with our youth. The common types of dispositions. So these are often the outcomes of juvenile court charges. So we have pre-court diversion, which has really grown over the past several years. Pre-court diversion is when a child is referred to the court, but there's a recommendation from the probation department and an agreement with the district attorney that the case can be handled outside of the courtroom, that the probation department can address the child's risk and needs effectively without court intervention. So that is, as I said, it has grown over the past several years and has been utilized, and we've been successfully utilizing it now for several years. The consent decree is diversion as well, but that is diversion from adjudication of delinquency. So those cases do go into court. However, the attorneys and the probation department come to an agreement that the child won't be adjudicated delinquent. Rather, the case will be set aside for about 6 months to kind of work through some, monitor the juvenile's behavior, achieve that community safety, that accountability, and that competency development. And at the end of the time frame, which is usually 6 months, the case is dismissed and the child is not adjudicated delinquent. There's also probation placement, and that is, I guess what you're used to hearing about when you watch TV. When people have violated the law, the court has found that they violated the law, and they are adjudicated delinquent and placed on probation. We also have juveniles who are adjudicated adjudicated delinquent and removed from the community because their needs just cannot be met in the community. Usually this is a combination of safety concerns, community protection, and the child's level of need. So again, as we saw in the slide before, this is not very common at all for our youth here in Delaware County, but it is a type of disposition available to the court. We do also transfer disposition to other counties. So when young people come from Delaware, Philadelphia, Chester County, and they are charged with an offense here in Delaware County, oftentimes we are able to transfer that disposition or that supervision to another county, where the county that knows their resources available to them may even know the family from prior dealings. So again, collaboration with the DA's office has produced increased and expanded diversion opportunities for children entering the delinquency system. So this is big for us because it resulted in a rise from 2023 to 2024 of cases diverted from formal court proceedings. And in turn, what we're really getting is quicker expungement opportunities for the youth involved in the court. We anticipate even higher numbers of pre-court diversion in 2025 as we become more comfortable, skilled, and we refine our practices. So that allows low-risk youth to avoid system involvement, leaving the resources available to the youth who need it. So something worth noting is that a change in legislation this year allowed probation to expand our automatic expungement practices. That included a certain population of cases up until this year. Now it includes an even bigger population of cases. So there are, the legislation expanded who is eligible for automatic expungement. And to be honest, many kids leave juvenile court and they are eligible for expungement, but they don't know what to do to achieve that. So what this legislation did was allowed our department to kind of say, like, don't worry about it, we got it, we will automatically do it when you're eligible. So as you can imagine, that results in more expungements. Let's see. So we did have probation maintained participation in the countywide multi-systems integration pilot program that began in 2022. So operating under the guidance of the Stoneleigh Foundation and Georgetown School of Public Policy, project partners included Juvenile Probation, CYS, the Office of Mental Health, and several local school districts. So you can see the goals of I won't read through them, but the goals of the entire project are listed up here on the screen. And in 2022, our efforts focused on implementing that pilot program's protocols, and then 2023 and 2024 efforts focused on data collection and analysis and refinement of the protocol practices. So we do, the leadership team does meet regularly, and the data is currently being analyzed for the pre-pilot and post-pilot implementation comparisons. We're eagerly awaiting Stoneleigh's report, which we understand will be released in the next few months. So in addition to the MSI project, we continue to maintain community collaboration with our police, our schools, and our community agencies in other ways. So efforts to improve juvenile justice in Pennsylvania started in 2025, but by 2012, Pennsylvania had developed a full juvenile justice system enhancement strategy under which 67 juvenile probation departments operate. Overall, the strategy has many components, activities, and effects. The underlying purpose is to continually work to achieve the best possible outcomes for our youth, families, and communities by focusing heavily on the use of evidence-based practices and the collection and analysis of data to improve decision-making. So some of these JJSES initiatives have a direct impact on service costs, while others consist of in-house practices meant to enhance probation officers' skills to lower risk levels of youth offenders and ensure positive outcomes. So an example is that we have adopted the standardized evaluation protocol. After extensive training by Penn State's Epicenter, several of the probation department staff members have completed evaluations on 3 highly used community-based programs here in Delaware County, and we plan to continue assessing and reassessing all of our providers. Overall, the SPEP evaluation process aims to increase program effectiveness in line with national research and standards for dosage and duration of services. So there are numerous other elements included in the JJSES, and we are fully committed to that process. In 2025, our department is implementing structured quality assurance measures to assist in the efforts to continuously improve the quality of our services delivered directly by our department, such as the evidence-based practices of YLS, Pennsylvania Detention Risk Assessment, motivational interviewing, EPICS, case planning. Those are some of the initiatives we're working through. And I will now turn it over to Dan Burke to summarize some of the actual numbers.
Thank you.
You got it.
Hi, I'm Dan Burke, and I'm going to be discussing the juvenile probation's recent out-of-home placements and detention admission trends, along with juvenile operations accomplishments in 24-25, as well as the challenges and priorities for probation moving forward into 25-26. As you can see, out-of-home placements had steadily decreased every year from fiscal year 13-14 through fiscal year 22-23. Over the last 3 years, placement admissions have leveled out a bit, with just 30 to 35 juveniles being placed each year. The overall decline in placement admissions over the last 12 years can be strongly attributed to probation's efforts to utilize the least restrictive settings possible for all delinquent juveniles, as those continued efforts have resulted in placement decreases for many years. However, with placement numbers as low as they currently stand, it is reasonable to expect that probation could see minimal increases in placement admissions over the coming years. Probation had also experienced a steep decline in detention admissions to coincide with the decline in placement admissions every year from fiscal year 13-14 through fiscal year 22-23. As you can see, the decline in detention admissions has been significant for every year from fiscal year 12-13 through fiscal year 2023. These numbers dropped even more significantly beginning in fiscal year 2021, as the decline was aided by the closure of the Delaware County Juvenile Detention Center in March of 2021, at which time the probation was only able to utilize other counties' detention centers and private detention providers, which both had very limited bed space and bed availability. The statewide implementation of JJSES has also contributed heavily to the decrease in detention admissions over the last 10 years. Over the years since the detention center closure, probation has contracted with any and all available detention providers and even secured a few reserved detention beds. While detention beds have been difficult to secure, probation has managed to secure enough beds in recent years that the number of juveniles entering detention in the last 2 years has begun to slowly increase and normalize back to some of the rates closer to the rates we were seeing before the detention closure. They're still a bit lower, but they're starting to trend back in that direction. Despite this small increase in detention admissions, you can see that the overall detention admissions are still just a small fraction of what they were 10 years ago. One major accomplishment realized by juvenile probation in fiscal year 24-25 was maintaining low overall placement costs, despite significant increases in provider per diems. In fiscal year 24-25, the average provider per diem increased by 7.5% compared to the previous year. Despite these increases, probation was able to keep fiscal year 24-25 overall placement costs right around where they stood in fiscal year 23-24. This was mainly due to decreased utilization of costly private secure and state secure placement providers in fiscal year 24-25. Probation has also continued to contract with new vendors to provide supplemental shelter and secure detention services in the years since the closure of the Delaware County Juvenile Detention Center. Probation contracted with other counties and private providers to secure any possible available detention beds, even securing 3 reserved beds for Delaware County youth. Though even with these new detention services, detention beds are still difficult to secure. Probation has also maintained historically low recidivism rates for juveniles within 1 year of discharge from out-of-home placements, with just 9% of juveniles being replaced within 1 year of discharge from placement, and only 14% of juveniles being rearrested within 1 year of discharge from placement. Both of these figures are the lowest recidivism rates Delaware County has recorded in the past 10 years. Probation has also expanded placement resources throughout the state by contracting with an array of additional placement providers in fiscal year 24-25. However, placement options remain very limited, and finding appropriate services for the more complex cases can be very difficult and costly, as some of these can range up to $900 per day, and these cases often require very lengthy stays and placements. One of the major challenges facing Delaware County juvenile probation going into fiscal year 24-25 will continue to be the lack of local detention. By only approximately 2% of youth entering the juvenile justice system require security detention. Not having a local detention option makes serving these youth more difficult. Without a local detention option, probation has had to rely on supplemental secure detention facilities throughout other counties and private providers. The lack of detention options has also led to an increase in the number of youth receiving GPS monitoring services, as the youth are awaiting residential services. Also, federal legislation passed in 2021, which requires certain juveniles that would otherwise have been placed in local jails to now be placed in juvenile detention centers, has created an additional challenge, as these juveniles usually have extremely long stays at our detention centers, averaging around 100 to 120 day stays just on average for just those juveniles. Another challenge facing juvenile probation is the current lack of available mental health services, drug and alcohol services, and specialized residential placement services. This has been a challenge facing juvenile probation for years, but the recent closure of Crozier has only made this challenge more daunting. There are currently long waiting lists for all of these types of services as a result of the very limited options available. In addition, probation has experienced an increase in the number of juveniles being denied admission into these programs due to the complexity of their cases. The top priorities for juvenile probation as we move forward in the fiscal year 25-26 are to emphasize strategic planning using the Pennsylvania JPO plan, as Melody detailed a bit earlier, and state and local initiatives. Another priority is to increase collaboration with PA-OCYF to ensure adequate funding. This, of course, is one of the main goals of the need-based budget process. As always, juvenile probation will continue to focus efforts on primary prevention to reduce or eliminate the risk factors that lead to delinquency. Another priority for juvenile probation as we move into fiscal year 25-26 is to continue to develop our local resources and increase access to statewide resources, as well as to continue to use the least restrictive and most appropriate setting to rehabilitate juvenile offenders. Going into fiscal year 25-26, juvenile probation will also strive to maintain the historically low recidivism rates for juveniles both replaced and rearrested within 1 year of discharge from placement through utilization of an array of post-placement in-home programs. It is also a top priority to decrease the use of secure placement facilities. Probation did see a significant decrease in juveniles entering state secure YDC programs in 24-25 through though the complexity of many cases, it can be difficult to find non-secure placement options for many of our difficult cases. Probation hopes that enhancing aftercare and reentry services can help to lower the days of care for juveniles placed in secure out-of-home placements.
Good afternoon. I'm Nelson Walker, Interim Director of the Juvenile Detention and Rehabilitation Services. The Delaware County Juvenile Detention Center remains closed in its entirety. The mission of the Juvenile Detention and Rehabilitation Services is to ensure public safety while promoting a positive social change for high-risk youth by providing trauma-informed rehabilitation services, leading with values that promote equity and well-being, maintaining an uplifting, safe, and secure environment for high-risk youth, developing staff to build positive and supportive relationships, providing varied and useful programming, treating family members as partners, encouraging community connections, and incorporating continuous quality improvements. The Department of Juvenile Detention and Rehabilitation Services is committed to collaborating with the juvenile courts, the Department of Human Services, and all other juvenile stakeholders to make informed decisions and determine the needs, resources, and service for at-risk youth and communities. In FY 24-25, JDRS supported 3 pilot initiatives led by 2 different agencies, each aimed at addressing the complex and varied needs of youth in our community. The first agency, YAP, or Youth Advocate Programs, a nationally recognized agency providing and promoting best practices in the juvenile justice community, operated 2 distinct pilot programs. The first was the Neighborhood Resource Center, the NRC, a drop-in center located in Chester, PA. The NRC served as a safe, supportive space for youth dealing with a range of challenges, including food insecurity, limited access to pro-social activities, bullying, mental health concerns, and academic struggles. By offering consistent resources and support, the NRC provided a stabilizing presence in the lives of young people who might otherwise have fallen through the cracks. YAP also operated the Targeted Intensive Prevention Services, TIPS, a program at Chichester High School. This program served students who were referred by school administration and staff due to a variety of issues, such as academic difficulties, challenges with socialization, mental and emotional health needs, truancy, tardiness, and peer conflict. TIPS offered intensive, individualized support to help these students overcome barriers to their success both in and out of the classroom. The YAP programs were very well received by the community as well by staff and administration at Chichester High School. The demand for services through the CHIPS program was so high that no new intakes could be accepted due to the space limitations. In response, the school is actively working to identify a larger dedicated space to accommodate the program's expansion for the upcoming school year. This strong engagement underscores the value and effectiveness of the YAP model in meeting student needs and providing meaningful support within the school environment. Please note the NRC program averaged 25 students a month. The TIPS program averaged 15 students a month. Also note the NRC and TIPS were not court-mandated programs by staff. They were purely through referral. The third pilot program we supported was Safe Corridors, a school-based initiative and also operated out of Chichester High School. Safe Corridors provided trained safety advocates who monitored high traffic areas within the school, particularly during the class transition, and offered critical support in areas where school staff coverage was limited. In addition, the program played a vital role in ensuring that the daily dismissal process was orderly and safe. The presence of these advocates contributed to more secure school environment and helped reduce incidents during high movement periods throughout the day. Due to the current budgetary constraints, we are unable to continue financial support for the Safe Corridors program at Chichester High School for the upcoming school year. While this decision was difficult, it reflects the need to prioritize limited resources toward programs with the greatest demonstrated impact and scalability. We remain committed to collaborating with school and community partners to explore alternative support strategies where possible. In FY 25 and 26, we are continuing our partnership with YAP and maintaining our support for both the Neighborhood Resource Center in Chester and the Targeted Intensive Prevention Services program at Chichester High School. These 2 initiatives have proven to be highly impactful in addressing the needs of at-risk youth, and we remain committed to sustaining, strengthening these services as part of our broader strategy to support young people in our community. In addition to the continued support of the YAP programming, we are actively working with Clock Tower Schools to launch a new initiative aimed at expanding a continuum of care for youth in our region. Plans are currently underway to lease space from Clock Tower in order to establish a community-based detention shelter. This shelter will provide housing for male youth between the ages of 10 and 17 with a projected capacity to serve 8 to 12 individuals at a time. The facility is intended to serve as a structured, supportive alternative to traditional detention settings and dependent youth needing emergency housing. It will provide a safe environment where youth can receive supervision, support, and stability while they await their proceedings or alternative placement. This approach is designed to reduce the negative impacts of detention, promote rehabilitation, and keep youth connected to educational and community whenever possible. We are in the process of establishing a pilot resource center in the Chester area to support at-risk youth and their families. The center will provide comprehensive services, including out-of-school time programming, mental health support, pro-social activities, and conflict mediation and resolution. Designed to operate 24 hours a day, the Resource Center will be managed by the local community with oversight provided by Delaware County. Our goal is to create a safe, supportive, and accessible environment that empowers young people and strengthens the broader community. In FY 25-26, we have committed to support a range of critical programs focused on addressing the needs of at-risk youth in our region. Looking ahead, we anticipate not only maintaining but also expanding this support to enhance the impact of these initiatives. This includes the development of an additional resource center in one of the designated zip codes with the highest concentration of juvenile arrest. In addition to our ongoing support for YAP, we are actively partnering with Clock Tower to launch new initiatives aimed at expanding continuum of care for youth. And additionally, we're in the process of launching our pilot resource center. Our overarching goal is to create safe, responsive, and empowering spaces that reduce system involvement and promote long-term positive outcomes for youth.
That does conclude the public hearing for this evening. If there are questions, we will have our email address in the PowerPoint handout as well as on the website.
Thank you.